Good afternoon. Thank you for joining us today. I'm going to be talking about a buzzword that's been getting a lot of attention lately, but it's a lot more than hype. In fact, blockchains, as it pertains to connected health, has some real potential to change the way we think about healthcare and healthcare delivery through patient empowerment. To start to talk a little bit about the problem, 40 of the 56 million deaths that occurred in 2012 were from essentially four major conditions: cancer, heart disease, stroke, and respiratory conditions. To give you an idea, these weren't even in the top five just 100 years ago. 300 million people died from smallpox just in the 20th century alone. And those individuals aren't dying from those conditions, and antibiotics and vaccines aren't going to fix that problem. And so when you think about the drivers of those conditions, it's really five main things: obesity, hypertension, sedentary behaviors, tobacco use, and poor nutrition. These are behaviors that can only be changed through proactive involvement of the patient. But unfortunately, patients have taken a very passive position in their own health due to payer and provider dominance and siloed clinical and behavioral data. And blockchain technology is able to break down those silos, can enable self-sovereign health record, a global unique identifier, and allow for the secure and seamless transfer of clinical and behavioral data between patient-authorized stakeholders. And you can layer on top of it, and this is what may even be the most unique aspect, an incentive model through digital tokens that can reward positive and proactive behaviors. And so you can start to build an ecosystem that's driven by the patient. So what is blockchain? It's a decentralized ledger of transactions across a peer-to-peer network that's open source. And using this technology, participants can confirm transactions without the need for a central certifying authority. One of the things we've heard about is cryptocurrencies. These are digital assets. You can also have utility tokens, and these are popping up quite frequently. We'll talk about that in just a second. But digital assets can take many forms to control the secure transfer exchange of digital representations of financial assets, data, identities, permissions, and rewards. So how does it work? A requested transaction is broadcast to an open peer-to-peer network consisting of computers known as nodes. The network of nodes then validates the transaction and the user status using known algorithms. So it's just processing power of these computers across the country that people are volunteering. Many of these nodes are placed in areas where energy is actually less expensive, like Iceland, where geothermal energy is big. Once the transaction is verified, and that can be cryptocurrency, financial transactions, contracts, records, or other information, that then block of data is added to a growing chain. And there's a hash associated with each block in the previous block, which is essentially connecting the entire chain. So if there's anything that's broken, the entire chain stops, which is why it's immutable. And over 8 years, no one's been able to hack the Bitcoin network. And all this occurs using your own node or your own network, or you can use an Ethereum network or a Bitcoin network that exists today. So what this does, it decentralizes the transfer of information. In the case of healthcare, you no longer need a central silo, but you could have a self-sovereign record that is able to move data like liquid between stakeholders that need it: patients, caregivers, loved ones, doctors, nurses, and between health system to health system. And so what we're seeing today is blockchain application is spanning a spectrum of industries that you see here. And in fact, many are being launched right now as we speak and have the potential to transform all of these industries you see here. And we'll talk about healthcare in just a moment here. But first, I want to go over the problem. We all know this. You have frustrated patients and frustrated doctors because patients have data stored in multiple EHRs across multiple primary care physicians or specialists. They have their behavioral data maybe in an app stored in MyFitnessPal. Maybe their steps are in HealthKit or a Fitbit app. Demographic information is one place, socioeconomic information is another, pain, stress, sleep. We don't record any of that. And so you got it spread over all these different silos, scattered. And so the promise of artificial intelligence, machine learning hasn't been realized because we can't really get the data. We have broad, shallow data. We don't have deep data, which includes clinical information. Medical imaging is another perfect example. I mean, we're still burning CDs and DVDs onto, or images onto CDs and DVDs to transfer them by hand. And so the idea is getting all that in a personal cloud storage that can be protected by blockchain and controlled by patient permissions is really the future, and that's what blockchain enables. So you're bringing together health apps, wearables, implants, mobile health solutions, handheld med tech, and various EHR data as well as medical imaging data into a single blockchain protected personal cloud storage tied to a global unique identifier that can transcend across state and national boundaries and can be shared through this open source network. That's a global HIPAA log. So how would this work? Mary might go to Dr. Jones's office. She has an app with a QR code on it. That's her public cryptographic key. Dr. Jones would scan that public cryptographic key, and he or she has their own cryptographic key, and that would allow for the transfer of data, clinical data, medical imaging data, into Mary's personal cloud storage. She then, a week later, would be going to Dr. Smith, who might be a cardiologist or might be another specialist who wants to study that she's already done with another provider. And most patients today are seen not in health systems, but actually small doc practices that have various EHRs. So in that situation, Dr. Smith can now scan the same QR code and see what Dr. Jones has had, whether it's an MRI or just the last progress notes. And at the same time, Mary now is compiling this data into her own personal cloud storage. And in addition to that, she's also compiling information over weeks and months of behavioral data, geographic data, sleep, blood pressure, weight. Now you've got contextual information with clinical data that can really facilitate machine learning and predictive analytics, allowing us to identify the true predictors of health and disease. And so what this does is it allows a patient to truly be empowered because they have access, they have control of a growing information set that they can then share based on permissions built into the blockchain. So for example, your payer now is layering a token, as we talked about earlier, and our token is going to be called the Vidamint, V-I-D-A-M-I-N-T. And that token now, let's say you take a small provider-sponsored health plan where they employ providers and they have patients, and now those payers are using vitamins to incentivize patients, healthy behaviors. Patients are now doing what they need to do. They're loading data into the cloud because they're incentivized with these tokens that can then be redeemed for premium reductions, prescription refills, and are highly liquid because these are being traded in the open markets, so these can be turned into cash. Providers now are being incentivized by population health, similar to MIPS and MACRA, that CMS has already said what's important. And while this data set is growing, patients can now share their data with pharmaceutical companies en masse, the med device industry, research and academic collaborators that want to see what were the predictors of heart failure admissions in a population on drug X or Y or Z. It will reduce the cost of research and allow for data gathering, and more importantly, it will allow for the patient to control who they want to share their data with versus Google or whoever else has control of data. And so the idea here is, and we've seen this, Medicare has released a number of chronic care management codes in recent years that have shown that payers, when they incentivize providers to do the right thing, to do services, fee-for-service, but do services around managing patients between office visits, you see improved population health and lower medical costs. The one person that we're missing out on is incentivizing the patient. And we've seen it's worked in self-insured corporations, and that's the last piece that we have to put together in order to really align the whole system. And this is what blockchain and digital assets can enable. It's an ecosystem around patient empowerment. So Mint Health, we are a global decentralized healthcare platform that leverages blockchain technology. My company that I started 4 years ago, MD Revolution, has a core patient technology, engagement technology that we've been using for chronic care management. My co-founder started Nucleus Health, and they are a medical imaging platform that has an active protocol to get medical imaging in the cloud and protect it with blockchain, and to streamline the sharing of medical imaging data instantaneously at high resolution onto iPads of diagnostic quality, iPads and iPhones. And so we'll be releasing a detailed white paper on vitamins and Mint Health in the next few weeks. Our token launch is scheduled for the December and January timeframe. And for more information, please visit us at minthealth.io or info@minthealth.io. Thank you.